like your tests, they won't be in any order. But I want you guys to start thinking about things, about teaching, what they should know, what you would ask them, those type of things. So it's just like kind of like last week. Basically, the more you guys talk about, the more we stay on it. Otherwise, I kind of jump through. The ones that I think you guys don't know more or sometimes need to talk about are usually in not the white or in the colored. So I will go through that more with the yellow and stuff like that but we'll stop on all of them a little bit. But so let's, administering medications, eye drops sometimes mess you guys up. How do you instill them? What would you teach with them? What shouldn't you do with them when you're instilling eye drops? There might be select all the apply on this. Anybody? No? Don't put the tip in your eye. Don't rub your eyes. Okay. Hold down the inner canthus. You guys are quiet today. Pull down lower lid. Drop in conjunctival sac. What, you don't want to squeeze your eyes really tight? Three to 5 minutes between different drops. Do you want to share your drops? No. Okay. Ear emulsifiers. What are you looking for? What are you teaching them about? Why are you doing it?
Get rid of wax.
Get rid of wax. Unclog. Yeah. Sorry. When would you not give an air emulsifier? Infection, membrane rupture. So if you see something leaking from the ear, should you put something into the ear? No. Okay. Decongestant sprays. What should you be teaching your patients about those? Short-term use. Why? Rebound. Very good. Okay. Remember how to spray them? Okay, that made me laugh. Sorry. Seth? Yes, one nostril at a time. Oh my gosh, that was funny. Sorry. I would love to see how you would do too. Sorry. Oh my God, you got me so good.
I think maybe Seth meant like put it in the nose and then hold your nostril closed while you take it. I don't know.
Sorry, I was just picturing it. Sorry, it's been a long week, guys. 2 weeks. Holy heck. Yes, okay. I'm like, no, stick one up each nose and, well, in or out? Like when you're putting it in there.
Away from the middle.
Thank you. Okay. Sorry. Hey, I needed that kind of, but thank you guys. Well, I'm tired too, and I know you guys are also. Asthma inhalers. Wait, can you repeat the answer? I'm confused. Okay. So when you're inserting it, remember you always kind of go towards not towards the inside, but towards what do you call it? Towards the outside of your.
Not towards the midline. So
Yeah,
point outwards.
Words today are hard. Asthma inhalers. Long-term, short-term, what are the difference?
Short-term are rescue inhalers, so they shouldn't be used recurrently. Should only be in an emergency.
Yeah, versus maintenance. I don't think the person who works at did their clinicals at the respiratory place should answer. No, I'm just kidding.
Or is that
Spacers.
the best person to?
Should everyone use a spacer?
Nope.
You should love it even if you don't have symptoms. What are you teaching with the long-term, short-term? Like, how do they use it? They're inhalers. And they're spacers, but they're inhalers.
You have to shake the inhaler. Depending on how old you are, it might be 2 puffs versus 4 puffs for a rescue inhaler.
Rinsing out your mouth, that's good too. Yes, and why do you want to shake it? What if you haven't used it in a year, your rescue inhaler? What would you get first if you didn't shake it? Dust.
Air.
You get you get that in the propellant. You're not going to get it. So you definitely want to make sure you spray off, right? Make sure, and then you don't take the first when you're taking them. So that's important. Why are we giving the prednisone? Yes, make sure it's not expired. It doesn't taste good when you have to take expired one either. That happened to me when the whole COVID thing was happening. Ugh. Pred. Why are we on Pred? What should you teach them about Pred? Inflammation, reducing. Should taper off use. Thank you. Thank you. What size is an intradermal injection? And why do you use it? Rinse your mouth, think that too, yes? And just think about what moods and stuff people are in, those type of things. But injections, testing, TB test, thank you. Are they big needles? Smaller needles. Where do you place it? Just under the skin. Please don't tell me you're doing an intramuscular. Also, think about the size and what you look at, because there are pictures sometimes of needles. And some of you give interesting injections. So know your needle sizes. Know what they look like, what type of needle you would give.
Is it a 27?
Yeah, 25, 27.
Okay.
Okay, so there's a lot of teaching I already said on this. So if you were nurse teaching about like cholinergics, what would be like cardiovascular issues that you should know with cholinergics?
It'd be
Increase
the opposite, wouldn't it? It'd be lower heart rate.
Why?
Because it's encouraging rest and digest.
So stand up slowly, right? Vasodilation. Yeah, bradycardia. Okay. What does Flomax do for BPH? Relaxes muscle. Are there any interactions with Flomax? Don't take Viagra. So there's a lot of these interaction type questions, right, with teaching, because that's what patients want to know. And that's what nurses end up with getting asked a lot is like, patient's taking this or got a script for this, and the doctor is obviously nowhere around, kind of thing. And hey, I'm taking this, also is this a problem, kind of thing. Sometimes they use the generic, and sometimes they'll use Flomax, and I think they always have the generic name with it if they use the Flomax. But when they just use the generic, it's just the generic. Yeah, also important to know, duration and when to take, those type of things.
What medication other than Viagra? Is that the only one you would think of? That is Viagra.
Pretty much all syndrome. Okay, so you're gonna, and we'll get to it in a bit, but there could be a possibility of a lot of heart drugs on there too. This is why you want to know about. Yes. Anticoagulants, interactions.
Watch for bleed.
No aspirin, yeah. What's with the vitamin K? You're going to see some of that stuff too. Okay. So when someone's taking triptans for their migraines, how do you know they understand how to take them? Because is it a preventative?
No, you take it if you experience an aura or signs that you're starting to have a migraine.
Correct. So they say anything else that is incorrect. You do not take it when you feel well. It is not one of those. It does not work that way. Okay. Parkinson's. If you are taking anticholinergics for Parkinson's, what should that patient be taught? And I'm going to tell you right now, you could have a lot of Parkinson's questions, just depending on how it works. Drugs for Parkinson's, obviously not the disease Parkinson's. Give at the same time every day. Not a cure. EPS. You guys and your little abbreviations, and I'm never sure what they're standing for, but you guys know. High risk heat stroke, increased fluids. Got it. Everyone knows what, and I'm not going to say it right because I don't do older people, but how do you say it? Donepezil? What it's for? Slows progression of what? Okay, Alzheimer's. Right. Not at the end, early on stuff, right? This slows the progression. Okay. Some Pharm teaching. Teaching about antidysrhythmic drugs. There's a lot of teaching on here. What would you want your patient to know? Some of these run into each other, right? They're kind of the same thing. Antihistamines, reactions, hypertension.